Welcome to the Local Pulse. I'm Dave Dicke, and today we are joined by Erik Sievers, who is the Executive Director of the Hiawatha Valley Mental Health Center, and also Ryan Buhler, who is the Marketing and Communications Specialist for HVMHC. So thank you, gentlemen, for being with us today on the Local Pulse.
Thank you, Dave.
Yeah, thanks for having us.
So we're going to learn a little bit more about your organization and some of the services you offer. And I know just we can talk about this more a little later in the show, but you guys hit a milestone this year at 60 years of service to the community. And what do you what was some of the growth that happened? I guess just real briefly, 60 years ago. I mean, mental health wasn't even really thought of much back in those days, was it? 60 years ago?
So I'll start with that, Dave. So what we originally started as a one clinic agency based in Winona, served three counties of Wabasha, Winona, and Houston. Um, in the 70s, 80s, a lot of state hospitals across the country were closing, and people in those settings were being asked to move back to their home communities, and through that we expanded programming to include clinic, housing programs and different programs in the community for adults in particular, then with either mental health or substance use needs. um, in the 90s we added peer support network for adults, where adults in three of the four communities we're in can come in and hang out and socialize and have a place to connect with other adults. We also added school-based mental health programming, so where we have therapists and throughout the region in schools. And then and to today, where we're in now five counties: Goodhue, Waukesha, Winona, Houston, and Fillmore County, and we have clinics in four of those counties. So a one clinic place, one building has now, five counties, multiple locations in most counties. So,
That's wonderful to be able to help get people the help that they need and not have to travel long
mhm.
distances to get that assistance to them.
Well, and
So,
one of the other services, Dave, that we offer is telehealth. So if somebody does have travel, we serve five very rural counties. So if somebody does struggle with transportation issues, telehealth is an option too. So we also don't necessarily have every single service at every clinic, but if you can get into the clinic, you can do telehealth from there, and then they get that service that we may not have in one clinic at a clinic that we have in our another location. So the technology has changed so much and made the availability so much better for everybody as well.
so accessibility really is not an issue anymore.
It still can be.
Well, to a degree,
Again, we
but
have rural communities, and some people may not have access to internet or have some of those things. But we're breaking down those barriers, one step at a time and one barrier at a time. And we certainly have a lot more access today than we did 10 years ago or 20 years ago, and certainly a lot more than we did 40, 50, 60 years ago.
so just how would you define mental health in the context for our community's needs right now?
So what I know is every county we're in, um, they do community health assessments, and every county we were in, one of the top one, two, or three areas of need is mental health, mental well-being. So it's a significant need, and I think it's just evaluating and helping people improve the ability to cope, um, recover, have enhanced emotional resilience to things. And some people recovery, in the community means maybe having a job and contributing in that way to society. So when I think of mental health in the context of community, I think, the prevalence of mental health and substance use is so significant that it's part of the community. It is an essential part of the community that people be mentally well. And a lot of the health assessments, like I mentioned, that are done throughout our region show that as a top one, two, three area of need.
I think I read that 1 out of 5 people in America experience some sort of a mental health issue. Um, is that fairly accurate? And what group do you see struggling the most with issues right now?
I'll take that one, right? So yeah, 1 in 5 adults in the country. That's been a number pretty steady for a number of years. That 1 in 5 U.S. adults experience mental illness each year. 1 in 6 youth, ages 6 to 17, and I think demographic wise, we do see um, we see more adults in our agency, but we see a lot of kids too. Kids struggling with anxiety, adults as well. Um, so I don't know if there's when we look at our population that we serve a lot of people through our agency who have serious mental health conditions or a severe emotional condition that really is very debilitating for them. And our services are there to help them recovery and live more of a life that they really want to live. And um, so yeah, for many years, and it's true today, the primary health conditions we see are anxiety and depression. So those are the top two, and those are kind of national numbers too. So still a lot of people looking for help with managing their anxiety and depression.
Do you think our reliance on digital devices does that contribute to some of that anxiety maybe, or is it that maybe that's just a small portion of what can cause it?
I know it's something that I'm asked a lot actually, and I think especially for our youth, our youth and our young adults who are more frequently on social media. And through that, I think there's the easier ability to be exposed to prolonged stressful things, whether it be negative messages. People can very easily now, because of technology, be very unkind to other people, say very hurtful things without ever talking to them. So I think technology and social media has done a lot of great things, but some challenging things. People can look like they're very connected to people and never really have any relationship with anybody. So that's a concern. You can isolate really easily now and feel superficially like you belong when you're really struggling. So
During the COVID-19 pandemic, it seemed like a lot of numbers started bumping upward with the isolation and such. Are you are people still struggling from that time period, or do you see some of the numbers starting to kind of level off as far as people seeking treatment for depression?
right after the pandemic, significant increase in children and adolescents. The services we provide in the schools, there was a significant need. Kids were really stressed and anxious, and when you're younger, you don't have the words to describe that, so you describe it by your behavior. And so we had a lot of kids throughout a lot of the schools in the area really struggling post COVID because there was still a lot of uncertainty, a lot of anxiety that we as parents or adults were feeling, and the kids were exposed to that. So I think honestly today, and I don't want to talk politics at all, but I think there's just a lot of uncertainty and anxiety heightened this year with new administration and some of the new policies and executive orders coming out, and a lot of when there's a lot of uncertainty, it creates increased stress and anxiety for people. So we are seeing that amongst actually our employees and clients today, people coming in. Yeah.
So I guess my next question would be, you talked a little bit about depression and anxiety. Are there any other mental health issues that are kind of prevalent for individuals in our area in particular?
So I don't have the data in front of me, but from working in the field for the number of years I have, the prevalence by condition has pretty been pretty consistent. So anxiety, depression, and then in our agency, and we are one of the few places actually where anybody can come in for services, and so kind of a safety net for people. And so we do see a lot of people with schizophrenia, bipolar disorder, borderline personality disorders, um, um, a lot of trauma. So PTSD, whether it be veterans or children or adults who have some experience in their life that has been a traumatic experience, and the challenges that you have following that. So those are the big ones that stand out in my mind right now of the people that we help in the community. In the substance use world, alcohol use disorder is a big one. So yeah, that's what we're seeing a lot of in the substance use area as well.
The thing I would add to that is with the substance use, we did start some new initiatives. So we have a MAT program, which is a medication assisted treatment program. And so that program is great, and it helps treat opioid addiction. So if somebody has that diagnosis, the MAT program uses a medication called Suboxone. Apparently I can't speak. But what Suboxone does is it helps block the effects of an opioid. So when somebody then tries to use those drugs, the effects aren't there. And so that done in conjunction with substance use therapy has been found to be really effective to eliminating overdoses and helping people with withdrawal symptoms and just kind of helping eliminate that opioid addiction.
So earlier you were talking about collaboration with schools. In addition to schools, do you collaborate with any other agencies? Do you collaborate with industries or any other entities?
Yeah.
I'm sorry, Eric, go ahead.
Oh, go ahead. Yep, you got
I
it.
was just say we're constantly trying to collaborate with other organizations, especially other nonprofits. So we're a part of other nonprofit organizations, groups, and we share ideas with each other and help spread the word. We try to partner up with other groups in the community. We partner with NAMI, Southeast Minnesota. We partner with other nonprofit organizations. The naloxone distribution box that we just installed on Friday is done in conjunction with Ripple, drug education and awareness group. So we have a lot of partnerships like that with community partners, and we're constantly trying to partner with other groups that are promoting mental health and substance use.
One of the partner that we've had, I'd have to do my research a bit, but for the longest has been our local county health and human services. It's been a big partnership with them for many, many years. One group here in Winona that we were a part of is a mental health collaborative group, which is made up of Winona Health, the Winona Sheriff's Department, Winona Police Department, Winona County Health and Human Services. And I think we're adding the school district to that group too, and Live Well Winona. So I might miss someone, but that's been a good collaborative group that meets pretty regularly over at Winona Health. So one of the things that we do value is partnerships, and really feel like there's so much of a need that we can do a great job by doing it with others. And so we do value those relationships.
Well, we're going to take a quick break, and when we come back, we'll be talking more with Erik Sievers and Ryan Buhler of Hiawatha Valley Mental Health Center about services that are provided to members of the community. So stay with us for that.
Evan, yeah, we have no internet. I don't know. It just stopped working.
I can't get online again.
Yeah, I'm talking to Evan. No, my daughter, my wife. Okay, can you guys not talk? Sorry. Yes, we have the white boxes. I see one. We have 11 of those. We switched our broadband service provider. Like Devin put in 11, Evan. The best part, I never have to speak to Evan or Devin ever again. Are we looking for 7, Evan, or 11? We have 2 next to each other. That's bad. 2 white boxes. Evan?
Welcome back to the Local Pulse on HBC. I'm Dave Dicke, and I'm joined today by Erik Sievers. the Executive Director of Hiawatha Valley Mental Health Center, and Ryan Buhler, who is the Marketing and Communication Specialist for Hiawatha Valley Mental Health Center. So thank you again, gentlemen, for being with us today. So let's talk about the services and resources that are provided through Hiawatha Valley Mental Health Center. And there are a lot of them. Maybe we'll start with youth and family services and what that entails. Toss-up question.
So yeah, our one of the big programs we have in the area, in the youth and family area, is our school-based mental health program. So a lot of the schools in Winona County, Houston, Rushford, Peterson, down in Fillmore, and Wabasha, Kellogg, and Wabasha, we provide therapist skills providers at least a day a week embedded in those schools. And it's something we've offered the community for, it might be somewhere in the 15-year area, 10, 15 years. We also have services, more of the traditional services in our clinic in Winona and in Caledonia and Wabasha and Red Wing, where youth and families can meet with either a psychiatric provider, a substance use counselor, or a therapist. So if you're a youth or family that looking for help in those areas, those are some of the things we provide. Whatever your age is, though, we offer mobile crisis services 24/7, 365 days a week across the 5-county area. So 844 crisis, 844 crisis 2 is the number for our mobile mental health crisis program. And it's on our website if people need that again, but it's something that's available any day, any age, any financial situation. It's a service we provide across the counties.
We kind of touched now on a couple of those things, adult services. Is there anything additional to add with adult services at all?
I think the big thing we provide, they're all regional programs, but they're physically located in the city of Winona. We have 4 board and lodge settings for adults with long-term housing and homeless and mental health needs. And then we have a 20 single bedroom apartment building called Hiawatha Bluffs in Winona. Again, for adults with mental health and long-term housing needs. So at one time, we can provide housing for somewhere around the 55 to 60 number of people. We also have a scattered housing site program, which I think we're getting near capacity of that, if I heard right, that we have we've established relationships with landlords to provide a housing option for people and support them in other people-owned facilities. So that's the biggest thing we do uniquely for adults in this community that I don't think a lot of other people do provide. I know a lot of other people don't provide.
One of the other more unique programs that I think we offer for adults is our peer support networks. And so in Winona, we offer a peer support network Monday through Friday. And Monday through Thursday, it's open from 9 a.m. to 5 p.m. And then on Fridays, it just closes at 2 p.m. But what our peer support network is it's a free, warm place. People can get out of the cold. People can socialize with other adults who are also going through mental health struggles. It's a safe place. They offer food and opportunities to meet and greet and talk to their peers, and also get some help from some other people who are like-minded. So it's a great resource in Winona. And then we also just opened a peer support network in Wabasha, and that's currently open on Thursdays from noon to 4. And then we also have one in Red Wing, which is open on Tuesdays from 12 p.m. to 6 p.m. And all 3 locations are 100% free to the public. And then you do not have to be a Hiawatha Valley Mental Health Center client. You can just be anybody from the community who's looking to get to socialize and to have some community outreach. So
Now you also offer some pharmacy services. Did I read that correctly? And how does that program work?
we do have general pharmacy in our Winona clinic, and it's anybody who receives services from us can utilize the clinic to fill medication. So we do have some medication that people take periodically with their therapy. And so we provide all of that here. It can also be medication that's not necessarily prescribed from us, but if you're a client of ours, you can get that medication filled here as well.
Well, let's talk training opportunities. You do offer training. Is that for, you kind of mentioned the schools and offering some stuff there. Is it like, what kind of organizations, I guess, would be someone that would get eligible for training like that?
So I actually had to look at our website, David, to see what we are offering today, but our website, www.hvmhc.org, on the homepage, for those that have access to our website, on the homepage, there's a community mental health training link, and looking at it today, in the this year starting in May, we have on May 23rd mental health first aid. May 20th, the same day in the afternoon, we have psychopharmacology training. We're providing an naloxone training in June, the motivational interviewing in June, and this year they're actually available for anybody who is not a mental health provider. So if somebody wants to learn about psychopharmacology, about naloxone, about motivational interviewing, there's a registration link on there, and the dates and times are there in the location. So it's something we started with a relationship we have with the Winona County Criminal Justice Coordinating Council. They received a grant, and we were a partner with them on that grant to provide these trainings. That grant ended last year, but we're continuing to provide these trainings to the community this year. So
That sounds like a wonderful opportunity for people.
yeah.
Yeah, one of the other grants that we recently received too is going to allow us to train the trainer for the naloxone, for administering naloxone. So we're pretty excited to be able to offer that training in different counties throughout the counties that we serve. And that'll be a great resource for people, so then they can then train within their own communities how to administer naloxone. So
Let's talk about naloxone and the dispenser that was recently installed. Was it just one in Winona, or are there other locations?
So this is the only location that we're aware of within all 5 of the counties that we serve. So what it is it's an old newspaper stand, and it has free naloxone overdose kits. It has the nasal sprays. So when you stop in there, you can pick up a box, and it contains 2 nasal sprays. And for those that aren't familiar with naloxone, it is basically can reverse the effects of an overdose. So if somebody has an opioid overdose, the naloxone can be administered through the nasal spray. Naloxone can also be administered intramuscularly, so it can be given in the buttocks or in the thigh or in the arm, and it can be done with an injection. And we do actually have those kits available at all of our clinics. So in addition to the naloxone box that we have outside of our Winona clinic, all 4 of our clinics in Winona, Caledonia, Wabasha, and Red Wing are what's called naloxone access points. And so we do offer naloxone free of charge. Anybody can just stop into any one of our reception desks during normal business hours, and they can get those. And in addition to the naloxone overdose kits, we also have test strips for fentanyl and xylazine. Fentanyl, I think people are pretty aware of. We're starting to hear about the prevalency of that. And it gets mixed in with a lot of drugs. It can be mixed in with other opioids, such as cocaine and meth. It can also be mixed on things like marijuana. It can be put on just about anything we're seeing. And it doesn't take a very large amount to have an overdose. And so having the naloxone kits on hand can help reduce that. But then the test strips, so somebody is going to utilize a substance, they can use this test strip to make sure that it doesn't have fentanyl or the xylazine in it. And the xylazine is a horse tranquilizer that magnifies the effects of other drugs. So we're seeing that sometimes mixed in with drugs as well. And of course, with as potent as fentanyl is, you definitely don't need it to be magnetized 10 times. So there can be pretty scary. So that's what the naloxone kits and the fentanyl and xylazine test strips are for. And those are also in the box outside. So there's also test strips in there. And then in addition to the xylazine, the naloxone, and the fentanyl test strips, There's also information for help. So if somebody is searching for some help, we do have substance use programs here, and we can certainly help. There's a QR code on the box that you can scan right from any mobile device, and that'll take you right to the registration page to get an appointment. And we strongly encourage people to seek out those resources.
So you brought up an interesting point about access to mental health care. Is outside of Hiawatha Valley Mental Health Center, is there a lot of access in our area to mental health care? Or is it something that we're seeing more of, or better access?
I think I've worked in different places, and the challenges for any mental health provider in general is meeting the demand. And we have areas that we have very good access today. Our psychiatry area, our substance use counseling area, are two areas in particular that we have within the same week access for people to receive the service. Other areas, we can get people in for an evaluation, but then there might be a wait. I don't have the time range in my head, but unfortunately, the access to services is the challenge. The one program that we guarantee there is no problem is with our crisis program. That's a program that no matter, we have 5 to 6 people on call during the day, people on call every night, all weekend, and on the holidays. That is the one area that there's very good access to that, but it's a challenge nationally. And we try to meet that. Ryan mentioned earlier about telehealth. That helps with reducing travel time for providers. We have some providers with us who are completely remote. So we've tried different things over the years to try to reduce wait, and we keep working on that as a country, honestly. So
we've got about 5 minutes left. I guess I'd just like to ask you, what can we do as individuals to help reduce the stigma that's attached to mental health issues?
Well, that's a great question. I guess I'll take a stab at it, Eric, and then I'll let you. We like to think of mental health as a necessary thing. You have a dentist, you have a mechanic, you have a doctor, you should have a mental health professional. And I think if people normalize that a little bit more, it would make it easier. It's just we've gone for so long thinking that was a weakness for somebody, or thinking silly things like talking about suicide might make somebody suicidal. And there's been so many studies that have shown that talking about things and normalizing it, it's the things are going to be there anyway. So normalizing it and being able to talk about it make people feel more comfortable with asking for help. And so that's what we want to do. We want to normalize things. We want to talk about them as much as possible. And we want people to we want to make people feel comfortable to reach out when they do need help, because we're all going to need it from time to time.
I think the other piece of that is, and it's something our agency is doing more of, and NAMI does a lot of this, is, helping people learn about mental health and substance use. So education, what everybody could do is learn about it, learn about mental health, mental illness, mental well-being, substance use, because there's a lot of misinformation and misunderstanding about what it is, and that's what adds to the stigma around it. So educating yourselves, participating in events that we offer. We have one on September 11th in Winona, outreach events, just to try to create awareness and education around it. And the other thing, and Ryan and I have been part of these events where, as you learn more, to reduce the fear or the concern of talking about it then. So either you are struggling, you're sharing with someone and they're helping you then, or you notice someone else struggling, you're not afraid to ask them, how are they doing? How could you help? You're concerned about them, you care about them, and we would obviously do that, as Ryan mentioned, if you had some kind of physical health condition, but mental health is still different. Unfortunately, we have work to do still, but I think it's gotten better. We still have work to do.
Well, and some of the other things we know are like isolation and things. So if you know people who are isolated, reach out to them, try to make them feel like they're included. When we feel a part of the community, we're more likely to feel and to participate in it. And participation and in getting away from, and not socially isolating are huge social determinants of health and really help make sure that we're healthy.
Well, Erik and Ryan, I appreciate you taking time out to talk to us today, and appreciate the work that you guys are doing and that Hiawatha Valley Mental Health Center is doing in our communities. Thank you.
Thank you.
Thanks.
And that is our local pulse for this week. We hope you'll join us next time here on the Local Pulse on HBC.